Welcome to the recording of the briefing BAND have recently delivered regarding the newly developed Critical Incident Policy and Management Plan. Myself, Jenny, and Michelle from the Development and Support team will be covering different elements throughout the recording. You can access the information on the slides by emailing us and requesting a PDF. If you would like a template policy and plan to work from, we have this available, and we have also worked up a scenario based on the plan template that you can access again by emailing us. All contact details will be available at the end of the recording. These documents are meant as a starting point for you and can be adapted to your needs, and any extra support can be offered by your Childcare Advisor. So let's move on with the briefing. The reason you may find a Critical Incident Policy and Action Plan useful is due to it helping to ensure safety, stability and well-being for all children, staff and families within your setting. Michelle is going to take you through the policy documents, Evelyn will take you through the planning process, and then I will be taking you through the plan itself, and we'll talk a little bit about the scenario that we have developed into a sample plan for you to reference. And then I'll also be taking you through the plan itself and other associated documents that you already have in place. Throughout the briefing, we will be signposting to organisations that can support you in times of crises or when critical instances happen. So, over to Michelle.
So it's all very well having a critical incident policy, procedure and management plan, but you can only use this appropriately if you really understand what a critical incident is and so know how to use it. So the definition is it's an emergency requiring immediate and exceptional response. So it's something that requires a response that's different to your normal operating procedures or usual way of responding to something. Now, thankfully, critical incidents don't happen very often, but this then means you won't have much practice of dealing with them. So therefore, the policy, procedure and plan are really important as these will guide you in your response and support you to know what to do so you can respond both immediately and robustly. So some examples are it could be a fire, flood or serious accident. It could be a death or serious illness. It could be a threat to safety or security, and that includes cyber security. It could be a safeguarding incident, or it could be a reputational crisis. So that's an incident that can impact on how your organisation is perceived. So that could be a decline in public trust due to a scandal, or maybe a safeguarding allegation regarding a member of staff. So there are certain features that make an incident a critical incident. So the key features are threats to safety, property or reputation, something that's likely to suspend your normal operations, and something that impacts the whole setting and not just individuals. So to give you some example, with safeguarding, if a child discloses abuse to you and you deal with this in your normal everyday child protection and reporting processes, then that would not be a critical incident. However, if a number of children disclose abuse about a member of staff, this was reported to the LADO, and on investigation it was found that abuse was happening systemically within the setting, this would constitute a critical incident, and in this case you would then implement the critical incident management plan. So to give you another example, a leaking tap in the bathroom that leads to that basin not being used whilst you seek a plumber to fix it isn't a critical incident, but a burst pipe flooding the whole of the toilet area may be a critical incident if you're unable to use any of the toilets for a period of time, as you would have to send both children and staff home. So hopefully these two highlight the difference between an incident you can deal with through your normal operating procedures and a critical incident that requires you to implement the critical incident management plan. So you need to start with a policy statement to outline your setting's overarching position and intentions on dealing with a critical incident. So it can be quite simple and something like what we have on the slide here. So it could be we plan for all eventualities to ensure the health, safety and welfare of children and adults. And then you could go on to say that your critical incident policy ensures that there's effective response to emergencies, it ensures the protection of children and staff, and it ensures safe and continuous operation. So why have a procedure? What is the purpose of it? Well, it's really important because generally people don't have a lot of practice in dealing with critical incidents as they don't happen that often. If or when a critical incident does happen, you might not have a lot of experience to guide you in your response. Having a procedure can therefore give you the guidance you need and be a way of supporting you. Having thought things through beforehand can help ensure staff and children are fully supported as well. The emotional and practical impact on staff, children and the setting is reduced. And it can help you recover quicker because things would have been dealt with in a more controlled and organised way. So thinking of the benefits, having a policy, plan and procedure should enable you to respond to a critical incident with more confidence and help you be consistent when responding. By building wellbeing into it, this can be supported more as well, which can then aid your recovery. It will help you identify who is most vulnerable in different situations, and so who might be most effective, and you can then plan accordingly. And it hopefully will enable you to stay calm, focused and in control, and so better able to deal with the situation. Sometimes when we aren't supported to deal with something, it's easy to get into a state of panic, and then it's really difficult to respond productively, and things can feel like they're beyond our control. You need to identify who is going to be responsible for putting the plan in place if and when a critical incident happens, and so you need a critical incident management team. Within the team, you need someone to take overall lead, someone to be the site safety or first aid coordinator and to liaise with emergency services, and someone to take care of admin and communications. Who does what will differ across settings depending on size and staff capacity. In small settings where there is a small team, the manager or deputy might need to take on more than one role, and if you're run by a voluntary management committee or board of trustees, the members of this might need to take on some roles too. The main thing to consider is to ensure that whoever is allocated a role can manage it effectively, so we would recommend allocating roles to senior staff. However, support staff and less qualified staff will have an important role to play as well, for example, in instances where lockdown or evacuation are needed. So it's important that plans and expectations are shared with them. So the responsibilities of the critical incident management team are to review and update the critical incident management plan, to communicate with staff, children, parents, carers and the media, to liaise with external agencies and to ensure ongoing wellbeing support. Now, it could be the same person or different people holding these responsibilities, and this needs to be detailed in the procedure and plan, and the whole team need to work together to implement the plan and achieve what needs to be achieved. So how does a critical incident impact those involved? Well, it may cause trauma to both children and staff, and it may cause disruption to the running of the setting or routines for children, staff, and also parents and carers. So ways to mitigate the impact include trying to recreate familiar routines as much as possible, having familiar faces to provide reassurance, supporting your staff so they can play a stabilising role, and ensuring that safeguarding and wellbeing always remain a top priority. So we recommend that your response is led by the National Trauma Council and their 5 key principles, and that is to stay safe, calm, connected, in control and hopeful. And these help to provide a simple but comprehensive framework that you can apply to all stages of your response and recovery, and this will support a unified approach to dealing with critical incidents. So safeguarding during a critical incident. So safeguarding must always remain paramount, and you must make sure that you have either your DSL or deputy DSL available at all times. You need to follow any statutory guidance, and you need to adapt your procedures as necessary. So you may need to plan for staff to be able to leave, for example, in the case of extreme weather, and you'll need to think about who you can release and when. So if you have staff who live somewhere that might become inaccessible, such as over the Severn Bridge or on a floodplain, you might need to prioritise them leaving first, whilst also ensuring the safety and welfare of the other children. You might also have staff that have to leave to collect their own children for settings that are closing, and again you need to make sure that you can maintain the safety and welfare of your children and the remaining staff. And this is where procedures may need adapting, and roles such as the deputy DSLs come into play if it's the DSL who's had to leave. When you've planned for some of these eventualities and everyone is aware of what might need to happen, then the implementation of it will be smoother and cause less friction within the team. So you need to think about financial and operational planning as well. This includes maintaining a contingency budget, reviewing insurance and continuity plans, and minimising disruption to the provision. So part of your planning needs to be around ensuring you can access all the information you might need whilst responding to a critical incident. So questions to consider include, how can you ensure you have access to all the information you will need, both during an incident and on an ongoing basis? Do you back up any data to a cloud or another server? If you have to leave the site, can you take the data with you? Now, it's a really good idea to have a pre-prepared go bag with everything in that you might need, and this should always be ready just in case. You'll need to think about what needs to go in it, for example, contact information and children's medication, and you need to identify whose role it is to pick this up. You also need to think what your continuity plans look like and where you can take your children in an emergency. You need to identify a premise you could easily access so that you would have somewhere to go, and if you can't return to your usual premises for a while, is there somewhere you could run on a temporary basis, and is there a budget allocated to this? If you're Ofsted registered, this would also involve informing them and complying with their requirements around it too. So who else can help? Well, you would never be on your own when dealing with a critical incident, and there are lots of people and organisations you can reach out to for help and support. So the local authority have a critical incident management team whose role it is to provide support during critical incidents. There's also Bristol Educational Psychology Service who can provide specialists such as educational psychologists, and they can provide support, guidance and resources for both children and staff. Then there's social services, the police and health services. CAMS might be able to help, and your local family hub might have services you can use as well. And you can, of course, always come to us at BAND. It's worthwhile finding out beforehand what support is available and how you would access, as again, this will help you be more prepared should something happen.
So over the next few slides, we're going to look at your procedural responses to a critical incident and think about what you can do to prepare and plan before an incident happens, during an incident, and then as part of your review cycle. So before these incidents can take place, preparation is absolutely the key. When we plan in advance, even if it is for unexpected incidents, then when something does happen, it's more likely to be dealt with effectively. Once you have a critical incident management plan in place, do maintain it and review it. You may need to plan for new or emerging risks or threats. Make it a live and relevant document. Make time for training and staff roles. Make sure that leaders check in on the understanding from staff members and identify where there may be gaps when there are staffing changes. Practice your procedures, things like evacuation and lockdown, to make children confident about the process, and talk about the different places that you might need to evacuate to for different reasons so that they're prepared for these things that might happen. Consider who your first aiders are and your DSLs. Can they be deployed to be with the children under different circumstances? And if they can't, you may need to train more people on your team so that they can be deployed when needed. Ensure child and staff contacts are available, whatever is happening. So having them on both paper and electronically with cloud-based backups off-site should ensure resilience for your setting. Have a backup copy of the plan to check for any actions as you're going through the process of dealing with an incident. When thinking about your response during an incident, as soon as any member of the team becomes aware of an incident that could have a serious impact on the children or the setting, they need to take action and the manager needs to know. Depending on the situation, the emergency services may be called first before contacting the manager if it is an urgent situation. Use your critical incident management plan to work on next steps. The priority will always be to keep children safe and your staff members, parents and carers, and any members of the community that might be impacted. In a difficult situation, staff may wish to contact their families to reassure them. However, the whole staff team needs to follow the communication protocols put in place to avoid mixed messages getting out, causing confusion. Also, staff need to prioritise their roles in a critical incident to ensure all next steps are covered. So do staff know what is expected of them? Have you informed them about what they can and can't do in terms of communication? And when are they allowed to let people know that they are safe? These are things that you need to make sure are in place before an incident happens so that the staff team know how they should be responding. And then we're thinking about what we need to do after an incident has happened. Have we contacted outside agencies as needed and supplied any information that they will want to see and have about how you managed the incident? Consider how you can support children, staff and families recover from the incident using the UK Trauma Council method of being safe, calm, connected, in control and helpful. Re-establishing routines, identifying with children what they did well and how everyone worked together to look after each other and stay safe. All of these things may help after an incident to make people feel calm and connected and safe and getting used to being back in their normal routines. Take advice from Bristol City Council's Educational Psychology Service. Strategies and resources to support recovery are available from them, and this may lead to commissioning counselling support depending on the type of incident that you've had to deal with. Review and update your plan, what worked well, what didn't, and use reflections to improve practice. Examine the operational and/or financial impact of the event. Do the long-term plans need revision? Does there need to be more in the financial contingency budget for unforeseen events that might happen in the future? We've touched on these points already, but to summarise, review your critical incident management plan regularly or if anything changes. Make sure you update your staff details and roles. As part of induction, make sure new staff know these plans exist and what they need to do if something happens, and keep learning from incidents and adapt. So it's the classic planning and review cycle. So you can apply the same principles from a child's learning to planning to deal with a serious incident. Okay, we're going to be moving on now to actually talking about the plan itself. We've talked about the policy and procedure, so let's think about again what a critical incident might be. So this is a list of some of the things that we've pulled together, and this list is available in the planning tool as well. And there will be some on the list that will feel irrelevant to you and your setting, but there will be others that feel more likely, and these might be the ones you want to start working through. Maybe think about planning for a few scenarios a term to build your plan so it's relevant to your setting and its context. And of course, as we've mentioned earlier, we have the scenario that you can use as a reference for planning for closure due to severe weather. So firstly, I'm going to talk to you about the plan itself and the sections within the plan. These are the sections that you can consider including so you have a framework for your response to a situation. Depending on the incident, your response may change. For example, your immediate response to an incident regarding damage to the building might be different to your immediate response to a serious accident on site. But the plan that you have in place will help guide you through so that you can be calm and methodical in the face of a stressful situation. So the sections that we have in the plan are guidance and introduction to the plan. So this has a lot of information about how you can use the plan, how you can set a template for yourself from the plan, and most of that information when you finish working on the plan can actually be taken out. It takes you through the planning process, through the preparation that you might want to put in place before a critical incident occurs, evacuation and shelter procedures, so if you had to leave your premises because of a critical incident, where you would go and how you would help ensure that children and staff are safe, roles and responsibilities within your team, roles of the individuals within that team, responses to an incident, so thinking about what you would do immediately, as a secondary response, so 24 to 72 hours on from the incident, in a medium-term response, and then as an ongoing response as well. It takes you through post-incident care and support, so what you might need to put in place to support any children or staff that are traumatised by the event and need that little bit of extra support to ensure their well-being. It also has a section for key contacts, so you can list who it might be useful to be able to contact in an emergency scenario. So you've got those contact details ready to hand within your plan. Talks you through thinking about communication. So who is it you need to communicate with internally in terms of your parent and carer cohort, your other service users, media, and possibly Ofsted or other statutory organisations. And then post-incident, thinking about who you need to debrief and how you review your plan and the response to the incident itself, and then maybe adapt or develop the plan further in response to that. Then it looks at what you need to do to be able to stand down from the incident. So that's when you actually close it off and decide that that's dealt with and completed, and you're going through your review processes and ensuring that your recovery plans are in place as well. So that's the way that their plan is actually laid out. Okay, so thinking about how you're actually going to work through and implement the plan, as you can see on the screen, there's a table. It's got some headings on it. So it has a section heading for the sections that I've just taken you through on the previous slide. It also has advice and information for consideration, and then wording that you can use within the plan to build that framework, to build that scaffold for your responses as needed. So we're looking at kind of adaptation to potential existing practice. So you might have risk assessments in place and knowledge within the setting of how you might respond to different things that have happened. So think about what the starting points are for your settings. What is the priority for you as an organisation? And then add this to the plan as you need to. So start with something that you think might be a priority for you. Work your way through the plan for that incident, and then you can go back and start again for another incident that you think might happen. So as I said, the plan is laid out into 3 columns. The advice and information column is used to prompt you as to what you might need to consider, and then the 3rd column is to add the specific information about your setting. Once this is agreed and in place in the 3rd column, you can actually remove the 2nd column altogether. So that will make your plan slightly more succinct and more accessible, because you don't have all of that advice and information for consideration to read through. You'll just have the section heading and then the actual plan of yours where you've put in your responses to the different sections. You may want to develop some of the sections of the plan for each different scenario you are working on, but some of the sections will be the same whatever the instance is. For example, the planning, preparation, evacuation and shelter procedures, roles and responsibilities. Those might be the same or very similar over different instances that you might be planning for occurrence of. But they may start to differentiate when you get to roles of individuals, responses to an incident, so what you might do immediately, secondary, medium term, ongoing, and then post-incident care and support, your key contacts and your ongoing service provision, communications and internal communications, etc. Those are the things that might differentiate depending on what the critical incidence is that you're planning for. We would suggest that you have within your plan the specific scenarios you have worked on listed with all the unique elements of the processes you have agreed you will follow, and these would sit behind the common elements. You may want to think about how you index this so you can access the information easily in an emergency. So, as I said earlier, we've developed a sample plan that you can see and follow based on a severe weather warning, and this could give you a starting point for the development of your own plan. We've all experienced severe weather warnings over the last couple of years. We've had extreme rain, extreme wind, snow conditions where we may have had to close the provision altogether, or we may have had to close early and get the children collected and release staff so that they can get back to their own children or back to their homes if they're in more inaccessible places, for example, over the Severn Bridge. So we've worked up this scenario to think about how you might work through all the different elements of the plan in response to a severe weather warning happening in Bristol and affecting your setting. So we have that available to you as a copy, as it says on the screen. If you want a copy of that, you can email michelle@bandltd.org.uk and she can send out an electronic version of that in a Word document so that you can have a look through and use that as your starting point for maybe the first element of your own plan. So we thought that severe weather was probably something that potentially could affect all of our settings, and we thought that that was maybe a useful place to start. So to summarise the whole briefing, you're probably feeling like these are big things to think about, but having a plan should be reassuring, and you may not capture everything, but there will be a basic scaffold to follow if something does happen within your setting. So thinking about planning ahead and reviewing it regularly, making sure that you stay calm and follow the procedure, communicate clearly internally and externally, prioritise safety, well-being and recovery of children, parents, carers and your staff, and learn and improve. So as you experience these things and move through the plan or move through different instances that might affect your setting, you're always learning and you can always improve your response to these things. So it's the classic plan, do, review cycle that you probably already have in place in your setting and are used to doing. There are other policies that you already have in place that will inform your critical incident plan. Many of the things that you will be thinking about will be detailed in these, so you don't have to repeat them, but you can refer to them. For example, your evacuation plans in the event of a fire will be in your fire safety procedure, or reporting concerns to the LADO will be in your safeguarding and child protection policy. So thinking about where you can pull information from, and the kind of policies that we think you need to think about in connection to your critical incident plan are things like safeguarding and child protection, health and safety, safer recruitment, fire safety and evacuation, data protection and social media, and first aid. So these are the main ones that we think you probably need to have regard to and pull information out of that you already have in place to make your plan more robust and more specific to your setting as well. We've also linked to a number of organisations that can offer support and information before and after a critical incident occurs. There is a more comprehensive list in the policy template, but these are examples of some of the organisations that are out there that can support you. So we've got .gov.uk, there's an emergency planning for education and childcare settings. We've linked to the UK Trauma Council's critical incidents guidance, and that includes their 5 overarching themes for recovering from a critical incident. There's the National Cyber Security Council, ICO, data protection guidance, and then educational psychology and local authority support as well. So these are people that you can refer to or call on if you are dealing with a critical incident and you need some extra support around a specific area. And finally, just thinking about what you might need from us. So as has been mentioned throughout the briefing, we have copies of the policy template, the management plan template, a PDF of these slides, the scenario, and any other support that you think you might need. Please do come back to us and email either Michelle, myself, or Evelyn at bandltd.org.uk, and we'll send out any of the documents that you want and then offer any ongoing support that you think you might need with actually developing or writing a policy and a plan yourself. So thanks very much for spending time with us and listening to the briefing, and if there's anything that you think that we can do to help, do get in touch. Thanks very much.